Thanks again for that great introduction. As you see up here, this is John Griffin, our proposed speaker, who had a personal emergency and couldn't make it. You'll see his bio in his packet. So for me to be John Griffin, I've got to be much smarter and also much handsomer, but I will give it a shot and try to pinch hit a little bit. Safe at school. As Nicole mentioned, there's just a couple slides I'd like to at least share with you. There's 13,000 children diagnosed with type 1 each year. It's an estimated 75% of newly diagnosed cases occur in individuals 18 years old, less than 18 years old. Dramatic increase of type 2 prevalence, as we've talked about. And improvements in technology and knowledge have enabled better care, but have increased management demands. Additionally, schools, we feel, must provide a medically safe environment for students with diabetes. Students with diabetes must have the same access to educational opportunities and school-related activities as their peers and support the child's transition to independence. We support the goal of a full-time nurse in schools as the primary caregiver for people with diabetes. We've focused on legislation trying to allocate more funding for school nurses every opportunity we get. I know that sometimes it's a challenge for our partners as school nurses to support this. They feel like perhaps it may be a scope of practice issue. Anything that happens that doesn't go to trying to add another school nurse may be something that they don't support. However, we feel very strongly that in the absence of a school nurse, that non-medical personnel can be trained to administer routine and emergency care. And even when there is a school nurse, what happens when that nurse goes home? No child should not be allowed to participate in extracurricular activities or participate in sports, or let's say go to take a trip to the state capitol. Let's say they were going to Austin. A child with diabetes would not be allowed to go if they didn't have that medical care along. And we know that non-medical personnel can be very easily trained to administer diabetes care. Even a full-time school nurse is, she can't be at all places at all time. And again, we support a safe model that utilizes trained school personnel in the absence of a school nurse. All school staff members need to have a basic knowledge of diabetes and know how to who to contact for help. The school nurse is the primary provider of diabetes care, but other school personnel must be trained to perform diabetes care tasks when the school nurse is not present. Students should be permitted to provide self-care whenever they are at school or school-related activities. We all know that the Americans with Disabilities Act allows for this. Section 504 specifically addressed this, and that the IDA, and we've had to go into states because we've seen, even with this Americans with Disability Act, Section 504, that some states are having a problem in terms of discrimination that takes place. I'll give you an example. In Washington, D.C., we worked on a piece of legislation that actually already exists. It was the Student Access to Treatment that was really focused on asthma. Well, the regulations that were to be promulgated, this law passed in 2007, had not been passed. So we had a case of an African-American child, her name was Letitia Taylor, who every time she had to test her blood glucose, they had to call her mom, Loretta Taylor, to come down from work. And this woman lost 7 jobs trying to take care of her child when easily non-medical personnel could be trained to help assist her in managing her diabetes. Well, one time when she came down to school, she got into an argument with the principal, and she was barred from the school. I mean, it was almost went to fisticuffs. Well, obviously she was not going to go to let her child stay in a school where she wasn't allowed to go, particularly since the need for them to call in and test their blood glucose. So Councilmember David Catania from D.C. City Council called an emergency hearing to address this and said, why isn't this law being promulgated? Why haven't the rules and regs been established? And he called the D.C. Department of Health and also the D.C. Main physician to address this issue and forced them this summer to address the issue of developing regulations so that non-medical personnel could be trained. And as of September this year, non-medical personnel has been trained, and they were allowed, that Letitia Taylor was allowed to go back to school. So this is why the law, even though the Federal Americans with Disabilities Act is out there, we still need to go state by state to ensure that discrimination doesn't take place. Additionally, we worked in Georgia, as you've seen in the model bill that's in your packet, to pass legislation. We also worked in Louisiana to pass legislation, but it's not also only just on the legislative side. We can also do this on the regulatory side, where we work with the Board of Nurses in Alaska to change the delegation rule. so that non-medical personnel, again, could be trained to administer diabetes care. Again, the federal law requires schools to identify children with diabetes, with disabilities such as diabetes, provide a free and appropriate public education, educate children with disabilities and other students as much as possible, allow parental participation in decisions, and provide children with disabilities with services they need in order to access equal opportunity to participate in academic and non-academic events and extracurricular activities. State laws and regulations. State and local laws and regulations, i.e. the Board of Nursing Regulations, vary regarding who may perform various aspects of diabetes care. Often there is no statewide policy. Rather, the policy is determined district by district. Regardless of state and local laws, requirements of the federal laws must be met. School diabetes care legislation passed in states with legal barriers to implement the federal law, and the Board of Nursing Regulatory Reform in 3 states. So our mantra is legislate if educate, negotiate, and litigate are not successful. So consider changing state law or policies if current laws and policies do not provide students with diabetes the protection they need. There are school diabetes care laws in terms of administering routine and emergency care in 28 states. We at the association feel that this is such an important initiative that it's become a part of our strategic plan in between 2012 and 2015 to add 12 more states to make sure they have the 3 tenets of our Safe at School campaign, which are self-management, making sure that a child can manage their diabetes within the classroom. I mean, I think that the situation is rife for failure if you have a child that is made to leave the classroom to monitor his diabetes or test his blood sugar. Could you imagine a child being hypoglycemic and wandering in the halls? All kinds of things could happen. Additionally, provide emergency care. Make sure that non-medical personnel are trained to administer glucagon in an emergency situation. If a child goes hypoglycemic and there's no school nurse around, one of the responses from a school nurse was like, well, what would you do if there was no school nurse around and a child went hypoglycemic? She said, call 911. We feel that that is wholly unacceptable when easily non-medical personnel can be trained, and we know that the time is of the essence, so that no child should be ever medically unsafe. And also routine care. We know that that may be more challenging than emergency care, but routine care can be, it's been proven, parents from all different socioeconomic stratas of life, from all different education levels, have been trained very thoroughly to be able to administer diabetes care. So we feel also that routine care is very essential and important. And again, we make this voluntary. We're not forcing any teachers to do that. We were asking any school employee who has an interest in providing this care to be able to provide this care. Additionally, we want to make sure that this is not something that is an unfunded mandate to states if they pass this in terms of the training, because right now there's no fiscal note attached to these bills of legislation. The American Diabetes Association provides training materials. We work with corporate partners which provide training materials, but we're also working with the American Association of Diabetes Educators and others to provide training as well once the laws are passed in terms of training these non-medical personnel who step to the plate and want to help with diabetes care. We feel very strongly that this is something that parents and people are very passionate about in terms of ensuring the safety of children and ensuring that they get the same educational access as any other child. I mean, this, we feel, is a very crucial issue. And with the prevalence of diabetes increasing, even with type 2, we're seeing the management of insulin with type 2 children is also becoming an issue. So we hope that as we move throughout the states to work on this issue, that we could look to you all to work with us on these issues in terms of making children safe. I think one first step is yesterday, your suggested state legislation committee endorsed the Georgia bill as a model to be represented to states all across the country. So I think that's a great start, and I hope to, as we move forward, to look for your support in protecting children with diabetes. So, thank you for the opportunity.